My name's Naomi Campbell, RGN. I recently started a new post as a hydration lead, which is the first time in the UK that an organisation has employed a nurse to develop a role specifically looking at the issues of elderly and vulnerable care in relation to dehydration. And this is basically in response to existing and past patient feedback through my hydration project, where over the last 30 years patients have been explaining that they're not getting enough to drink in hospitals or in care homes. And despite all the feedback that's come in over the last, say, 10 years and through the national media, the problem of dehydration is actually getting worse.
NHS Innovations South West has been very much supportive of the hydration project from Cornwall, Peninsula Community Health, led by Naomi Campbell, as one of our Trust Innovation leaders. This project has really brought together around recognised national and international unmet need, a whole grouping of interested parties, those that can spread best practice and those that can develop ways of tackling and improve service required for the elderly and vulnerable patient groups. One of the aspects we're looking at is where we can secure further funding to take forward the activities of the different aspects of the project that have been developed. These include looking at device development, systems around software and information spread, best practice through training, education. This is going to be something that develops with the evolving and emerging networks of providers and practitioners within the NHS and the social care and community care aspects within Cornwall and the wider NHS in England. We also understand that this is something that can be taken through NHS Global and other partner channels internationally as best practice, and to be communicated around how to look after the vulnerable and the frail and elderly patient groups.
I just want to ask that the project does receive a very clear message to yourselves when deciding whether funding will be available, because I believe that this project represents a framework to deliver best practice hydration care, which has already been established by the Department of Health and Care Quality Commission, but being able to create a sustainable model that can work in all areas in communities and acute hospitals and domicile. I'd also like to reiterate that whilst the model has been based on hydration through the experience of me developing my hydration project, that actually the framework and the issues and the principles within this model could be applied to any other health issue, such as mental health, adolescent care issues, learning disabilities, and identifying gaps in the service and the chain of care. Often it's the patients that identify those gaps. And the bottom line is, with regard to my application today, I'm asking you to help me with the project to enable all our elderly and vulnerable patients to have enough to drink. Thank you.
The hydration project works very well and aligns with the new national initiative, Innovation, Health and Wealth, developed by the Department of Health, looking at continuity and improvement of care from the acute setting in the NHS through the various custody points of providing care in the community, through to domiciliary and provision of care at the home and away from tertiary healthcare provision.
Sarah Newton, Member of Parliament for Truro and Falmouth, and I'm delighted to have the chance to support this project. Like so many people around the country, I cannot believe in the 21st century that people are literally dying because they're not having enough water, whether they're in a care home, in the community or in a hospital. And despite the fact that lots of governments have spent huge amounts of money developing best practice and national guidelines, something is going wrong. And I believe this work, led by Naomi, is really going to get to the bottom of the issue, because it's working with the people who are actually delivering the care. And it'll be working with the best practice, with the best guidelines, to make sure that those people who can really make a difference and make sure people are properly hydrated are going to be supported to do so and have all the tools and all the education that they need.
I'm David Clark. I'm with Flotilla Media. We're a specialist communications agency and one of the specialist partners working very closely with Naomi on this project, and we're very happy to be involved with this. Our role really is around clear communication of the project, of its aims and its objectives, communication of the issues around hydration, and importantly, we believe the production and distribution of video-based training and best practice material that can be widely accessed by healthcare professionals at all levels, so they can take effect and improve the way that hydration is monitored and the issue of dehydration is alleviated.
Zero Solutions are thrilled to be a part of the bid for the NHS Patient Feedback Challenge. Zero Solutions work at improving patient health outcomes by using mobile health and integrating mobile technologies and health processes. One of our solutions is all about gaining patient feedback, and this is done through using various devices such as a tablet device, a mobile device, or by using a printed electronic smart card with an RFID tag at the end. All these devices can be used to gain patient feedback and then can be uploaded and automatically generates reports, so it's quick, easy, confidential and is all in real time. We partner with the likes of BlackBerry and have worked with the Strategic Health Authority and high-profile GPs such as Dr Ian Greaves in Stafford. We also work with dentists, pharmacies, domiciliary care providers, the security industry and many more. We are very proud to be part of this bid application team, as we not only believe that this model can be rolled out nationally but worldwide as well.